Hello everyone, welcome to our live at lunchtime every Wednesday, 1 o'clock. I'm Michelle.
I'm Melissa.
Alex is behind the camera, and this is our handsome Dallas, who's been with us for this past month for National Hoof Care Month. Right, Dallas? Right. He's like, yes, I'm learning that I'm famous.
He is going to be very famous after the month of February.
That's right. He's such a good boy, huh? So we are going to continue talking about the hoof. We've talked about basic hoof care. We've talked about the anatomy of the hoof, inside and out. And this week, we are going to touch a little bit on 2 diseases of the hoof.
That's right. So we're going to talk about 2 of the most common ailments that you'll encounter with any kind of equine, and also 2 of the most common ones that we find here at the sanctuary.
Yep. And really with any equine, this is what you have to watch. This is what you have to watch.
You have to watch out for these 2, and especially as we're getting ready, we're gearing up to go into spring. We're having full spring today. It is a balmy 55 plus degrees out right now, and that means that everything is turning into mud. Mush. And mud makes the perfect environment for hoof issues to start brewing in our equines.
And we are going to explain why.
So the first ailment that we want to talk about is thrush. Thrush is a common bacterial infection that equines will have in their foot. It affects the frog of the foot. If you remember, the frog is the kind of spongy portion. It's shaped like a little triangle, and it's on the sole of the foot, so on the underside, what we don't see all the time.
That's right.
So if we don't see it all the time, what does that mean? It's in a dark, damp environment, which is the perfect breeding ground for bacteria. And it's very common in mud seasons. Dallas agrees. He says, yes, that is right. You can't see it, and it's in the mud.
Yes, and it's kind of unmistakable, and it can happen when there's lack of exercise, because I found what's fascinating about thrush is that a horse that gets regular movement, exercise like our horses do, a lot of them, it will clear out all that yucky bacteria and stuff when they step. It expands, and the yucky stuff kind of expels. Obviously, good hoof cleaning helps also. But it still can happen and befall our horses even.
Especially when all they're doing is standing outside 24/7 in a wet environment, which is just what happens to horses that are pastured all the time. And during the times of years when the ground is just mud, even though they have dry stalls to get into, a lot of times they'll be walking through their fields, and their fields are wet. So it's a great breeding ground for it. So what do we look for when we want to see if our horse has thrush?
Right.
We're going to routinely pick their feet, and we're going to keep an eye out for a strong odor, number 1.
Yeah, that's a telltale sign, is that strong odor.
That strong odor, and if you've ever smelled thrush, you know exactly what we're talking about.
Yeah.
It's pretty stinky.
Pretty stinky, and it usually happens, it can happen in the front end, but it's more common in the hind end.
That's right.
And it's like a dark, almost like
dark, blackish color.
Yeah.
And it'll run along in those nice deep grooves that Michelle had talked about during our anatomy class last week. It runs along in those grooves, and that's the first spot that you'll usually find it. But the good news is it's very easy to treat.
Yes.
If we can remove the horse from their wet environment, we'll do that first. So a nice dry stall is a perfect way to take them out of that damp, wet environment. And then also what we're going to use is a commercial product that helps take care of thrush. So we have 2 of our favorites here. This one is Groom's Hand. This is great for my equines who will tolerate an aerosol can. And then there is Durasol. There's also a similar brand called Thrush Buster. And those you apply them directly to the sole of the foot. Always read directions to see how often you need to apply them and reapply them. And you keep using those until your thrush is all gone. So it's very simple.
It's very easily treatable.
Yes.
And there are lots of products out there to treat this and help
plenty of them. These are just 2 of my favorites that we use here at the sanctuary on all of our equines, Groom's Hand and Durasol. These are fantastic. Huh, Dallas? He says, yes, they are. That's right. So thrush is one of our most common issues that we'll see, and then we also have abscesses. Abscesses is another big one, and we have a great way. Mr. Dallas here is perfectly sound and has no abscesses to speak of. Yes, none to speak of, but thanks to Horse Science Anatomyworks, which is owned in part by our podiatrist, Dr. Jared Pullen, we were able to get an anatomy model of a horse hoof that had an abscess when it passed. So all of his hoof models that he and his partners get at Horse Science Anatomyworks all come from ethically sourced donated equines, and they're used to make educational models for veterinarians, farriers, and organizations like us who might have to do some anatomy classes. So we're going to show you that next, and I'm going to show you what an abscess actually looks like in the equine hoof.
This is exciting.
Thank
you so much, Dr. Cullen. We really appreciate
We appreciate Dr. Cullen and his partners. And if you are an equine professional or an equine teacher and want to get an awesome anatomy model of the hoof or leg, you can head over to horsescience.com. They have a whole array of them, and they'll custom make some for you. So they are fantastic. We love Dr. Cullen and his partners, and we appreciate them loaning us these models. We'll have another one next week when we talk about laminitis and founder in equines. So, but today, back to the abscesses. What's the scariest thing you can see when you show up to the barn to go see your horse?
Oh my gosh, when you see them limping around and they're lame and you don't know why, that's kind of scary.
It gets scary.
Yeah, because you don't know, you think to yourself, oh my gosh, is there a fracture?
Did they break their leg?
Right.
But I can tell you, most of the time, that horrible three-legged lameness, not a broken leg, not even a soft tissue, it's just an abscess in their hoof. So an abscess is when the equines get a bacterial infection inside their hoof. It happens quite commonly. There are always little, thank you for pushing me. There's always little tiny micro abrasions in the sole of the hoof, and dirt and debris can get in there, little tiny grains get in there, and it causes bacteria to form inside that nice hard hoof shell. So the hoof wall is not exactly easily penetrated. And you can see here on our model, this equine had, or actually this was a horse, and they had a very big abscess. So right here is where the abscess was on them. And then we're going to turn this over. So this is the interior of the horse's hoof. And then we're going to turn it over. So this is what you would be seeing looking down. So this hole, your farrier will come out, or your veterinarian will come out and use hoof testers, which will show you to find where it is. And then they'll gently dig a little hole out in here so that hopefully the abscess can drain.
Yeah, you definitely want the abscess to drain. So just like if we have an abscess, you want it to drain. So there's special treatment for treating an abscess. But first, we're going to talk about these hoof testers. These come in handy, and every horse person should have one and know how to use them.
So these are hoof testers. So, and I'm going to show you on Dallas, who's going to be our very patient model, and I'm going to show you how we would use these on him. So say Dallas was very lame. When he came into the barn, we would pick up Dallas's foot and then we would use these hoof testers by placing them on the sole of the foot. And you can see, you should be able to squeeze them. You really don't get much of a reaction from him. But if I did this and all of a sudden he said, ouch, and he pulled his foot away, then I would know that that's most likely where that abscess is. And then that gives our farriers and our veterinarians a chance to come out and start looking around for, maybe they can find a little hole they can put in so that the abscess can start to drain. But if it's really deep, we have ways to start softening up the sole and make that abscess want to be drained and come out to the surface. So,
and of course you would ask your vet how many times you should treat it and soak the foot, because you don't want to soak it too much, because then the hoof sole gets too soft and cause other issues.
That's right.
So you want to make sure that you consult your veterinarian always and see how often they want you to do this.
That's right. So you can start by soaking their hoof. Traditionally, we would soak them in Epsom salts and water. But sometimes we have equines that they just don't want to stick their foot in a bucket of water or a pan of water. So we have these medicated pads, and they have a drying agent inside of them. Now, normally we would wet these before we put them on, but since Dallas is sound, I don't want to ruin a good one. So what we would do is we would take this nice and wet.
He said, what are you doing?
He says,
I
why
have
are you
abscess?
doing this to me? He says, but my feet are fine, guys. Can I have that? He says, you may not have my foot. There we go. So, we would put our animal Lintex pad down, and you can also do this with, I have done this with a baby diaper and soaked Epsom salts.
Yep. Yep.
I have packed a baby diaper with Epsom salts.
I have also seen that. It works
Yep.
quite well.
And use the exact same thing, and it's quite cost effective. And then we use vet wrap, which is this material I'm putting over his foot right now. And we would wrap Mr. Dallas's foot.
Because it's important to keep it clean. You know, if
That's
you
right.
have any sort of wound,
You want it
obviously
nice
you
and
want it
clean.
nice and clean. And that's the purpose of doing this.
So we
Besides soaking and drawing out the abscess.
wrap him up like a little mummy.
Now, how does that stuff stick, Melissa?
So vet wrap is fantastic because it sticks to itself.
Wonderful.
It'll stick to itself, but it won't stick to you.
What a good boy, Dallas. He's like, this
And
is
then-
ridiculous.
I know, he's like, this is crazy. You can put on a little duct tape boot, which this isn't exactly the greatest duct tape boot I've ever put together.
Now, let me tell you, Melissa's a pro at this.
But this
Duct
duct
tape
tape boot is just gonna protect the bottom of this so it doesn't all rip apart.
Yep. And how she made that, she just ripped pieces of duct tape, put it on her jeans until she was done, and slapped it on.
And that was that. Now normally I'd wrap him with some more duct tape to get it nice and secure. And then, if you wanted to forego the duct tape, you can put on a soft ride boot. So these are great. They're like temporary shoes. Basically, sneakers for your horse. So you could take these, wrap your horse's foot, and remember, abscesses are pretty painful for these guys.
Oh, absolutely.
So soft rides are really convenient to have on hand because they also have these nice cushions
Yeah.
inside.
Oh, it's
They're
nice
very-
and thick. Nice and thick and
Yeah,
spongy.
so this is a thick spongy cushion here. You can see how my finger press it around. So this is really comfortable for the bottom of his foot, which is gonna be very painful right now. These are gonna be big on Dallas. These belong to my horse, Duchess, who is just a little bit bigger.
Yeah.
Do you want to lift up again for me? He says, lady, I'm done lifting my foot up.
He's like, I don't have an issue, people.
So, actually, we feel pretty good. So we would put this on, get it all nice and secure, and now Dallas has some extra cushion, and then we would change out his animal Lintex pad every other day or so, or as often as the veterinarian wants us to. And then hopefully, at some point, we'll pull it off and have a really funky smell in there that tells us the abscess is draining finally.
Yes. Which is what you want. It's gross but needed.
Gross but needed, exactly. Gross but necessary is the name of the game with thrush and abscess.
That's right.
Abscesses.
What do you think, Dallas? He's like, well, I think you guys are being a little silly when I don't have anything wrong with my hoof.
He's like, I'm not quite sure what happened to me today, but I thought I was feeling really good.
He's like, no, I'll go with it. I'll go with it. Here, I'll give you a treat with your feet. It's so good.
He says, yes, please.
So good.
Do we have any questions from anybody out there about thrush or abscesses or how to take care of them when they have it? So these are your two most common ailments. I'm just going to pull this off of Dallas.
Yeah, poor Dallas. While you're doing that, I'll talk a little bit about, again, some of the signs of abscess. So you go outside and you see your horse limping around. First thing you want to do is feel for heat or pulse in the hoof. Usually heat is a sign of infection. You want to take those hoof testers and help pinpoint the location of the abscess. You want to clean the hoof, make sure there are no obstructions. This is very important. If you find, for some reason or another, a puncture wound or something stuck in your horse's hoof, should you pull it out?
Never remove it.
Never remove it. And the reason
Always
is
leave it.
because a puncture wound, you always want to call the vet right away. The vet has to come out. They're going to see, the reason you have to leave it and not take it out is because the vet needs to see how far it went in and what structures it might be affecting. And if you take it out, they won't be able to see that.
And the most important thing to think of is think about how big. So normally they would step on, most likely, a nail or a screw from your fence lines or from really old, back in time, it rains, the mud churns up old rusty nails. And you can see, you figure a fencing nail is about this long, which it can puncture through into the really protective areas that we need to keep very, very safe.
Where all the nerves and the tissues and all sorts of things, blood supply, all that stuff is in there, tendons.
So you always want to radiograph first to see if it's touching any sensitive structures and to see what might be compromised, because that's really going to dictate how you care for that injury. Because at that point, it's an injury that will probably turn into an abscess.
Yes. So if you ever find a puncture wound, that gets called right away. Do not remove it. And let's see, what else? We already talked about how to treat an abscess, which is soaking the hoof, keeping it clean, keeping it dry. Medicate if needed. If they're in a lot of pain, you can medicate. What would you use?
You would use some type of anti-inflammatory like Bute or maybe Dramamine. That would all depend on your veterinary, the recommendations of your veterinarian. They'll let you know exactly what to give your horse and in what dosage and how often. So it's always important to make sure that you're giving the right amount at the right time and the right frequency.
Now, how long does it take for an abscess to clear up?
It can take an abscess anywhere from 1 week to a few weeks. And the other important part, so you saw I wrapped the sole of Dallas's foot, but sometimes abscesses don't just come out through the sole. It's natural for the body to want to push out that infection that's in down. So it wants to go the direction of gravity, but sometimes abscesses are tricky little guys and they will go up. So an abscess, instead of coming out of the sole, will come out through the coronary band here. Now remember, the coronary band is where the hoof wall meets the skin that has all of the hair attached to it. So it's going to go through here, which might be the path of least resistance for that particular abscess. So, and you can use the exact same products, Animal Intex. You can cut a little strip and wrap it around here to try and soften up these tissues here and give that abscess a little easier time with draining out through the coronary band.
That makes sense, yeah.
And then you'll see, once it drains, you might see some icky looking discharge coming out of the top of their hoof, running down their hoof wall. So you just want to keep that nice and clean, especially if it's warm weather and bugs are out. Keep it clean, keep it covered. And then after that, as the hoof starts to grow, that little hole is going to slowly start to grow out, and it's not even going to be an issue anymore. So you won't have a big, huge hole there hanging out for forever.
Got it.
Eventually, it'll grow out. It takes approximately 1 year for a new hoof to grow from the top of the coronary band and reaching the ground.
Interesting.
So,
that I did not know.
At some point, it will be all gone. And just an ugly memory of smelly limping horses.
Yes. But this is just part of normal horse care, and this is something you have to watch for. This is why we are always checking our horses. Melissa here checks our horses, and Susan, of course,
all the time.
Every morning, every night, all day long when they're out. So they are constantly being checked on. And that's a big job, let me tell you, because we have 80 horses, 80 equines that need checking, and that's a big job. So thank you, Melissa, for all you do, because you do quite a lot.
If we times that by 4, that's way too many hoofs.
That's
a lot of feet to check.
That's a lot of feet.
That's a lot of feet.
Now, another thing that we might want to mention real quick is we talked about puncture wounds. Any laceration of the hoof or the coronet band or the coronary band needs to be, the vet needs to be called right away, because any laceration can also cause an abscess.
And it can also cause infections that go to other bodily systems and affect the surrounding tissue. And we don't want that. And if they have a deep enough laceration, they'll need to be on antibiotics, which you will need to get from your veterinarian. Depending on how bad it is, will depend on which type you wind up having to use for your horse. So it's always very important. When in doubt, call your vet.
Absolutely. And that's it. So basically, how to prevent this: routine farrier care,
routine
hoof care, avoid extreme wet, extreme dry conditions, because dry can cause cracking of the hoof. It also has to be watched.
Which winds up opening it up to bacteria.
Which is why people equestrians and horse people use hoof dressing.
That's
Yes.
right. That's right. We use hoof dressing.
Non-petroleum.
Non-petroleum
Right? Non-petroleum is the best. And watch for injuries. Horses that stomp their feet a lot can cause damage to their hoof wall, so you want to be careful of that.
Fly season, and then a nice rainstorm that gets all that mud churned up. Usually is a good time to go out the next day and check.
Definitely.
Keep an eye out for a few days after that because something might be brewing.
Yeah, and that's actually why I had a question a couple weeks ago about why do we have those bell boots? And it's for the horses that are kind of rough on their feet.
That's right,
protect
yes.
their feet, it protects their hooves.
Yes, protects their hooves.
Shoes for horses that need it. Some horses are more susceptible to this, so watch it closely. And that's pretty much it.
And sometimes shoes can be used to help with cracking. If your horse is experiencing a lot of hoof cracking, you might be able to have your farrier work out a way to start preventing that and start healing their hoof. And that might involve either just traditional shoeing or therapeutic shoes that can help to maintain the hoof wall. Supplements that help maintain your hoof health.
There's amazing supplements out there.
There's some fantastic ones. Farrier's formula is one of them. And just plain biotin. Just like it's good for our nails, it's good for theirs too.
Absolutely, and we use that here. We use that here. Farrier's formula. We use that.
We do. We use that on all of our horses with poor hoof quality. So, and hoof quality is determined in a lot by food, their nutrition, but also just their genetics. Some people grow better nails than others, and it's the same in horses. Some horses grow nicer hooves than others.
Yeah, tell me about it. All right, well, I hope you all enjoyed this and learned something, and we were glad to have you. If you have any other questions out there?
Any questions out there for us before we go?
No? All right, well, actually, you know what, before we go, we mentioned the prevention for abscesses. We can quickly go over, we talked about thrush. It's basically the causes of thrush could be abnormal hoof growth, inappropriate or lack of trimming or shoeing, insufficient exercise, chronic lameness issues, poor circulation to the frog, and horses with deep crevices are called sulci, it's called.
Are more prone, can be more prone to it.
So those getting stuck in there.
That's right. So you want to make sure that if your horse has a really deep groove in their hoof on either side of their frog, so you want to make sure you keep it nice and clean and nice and dry. And then, so that's the basics.
That's it.
For thrush and abscesses, two of the most common hoof ailments. So join us next Wednesday at 1 for our Live at Lunch. We're going to be finishing out International Hoof Care Month, talking about laminitis and founder. We're going to have two awesome anatomy models to show to you of equines that have founder that are on loan to us from Horse Science Anatomyworks. And we can't wait to show you guys and then teach you about these other two common ailments of the hoof.
That's right. All right.
So we'll see you next week.
See you next week.